So thanks for the opportunity to get up here on the stage, and I'm going to go stage/soapbox just to highlight the role that nurses play, particularly in primary healthcare. So these are my declarations. I always steal John Litt's words that I'm not going to karaoke these slides because you can all read them quite fine. I thought I'd just start with this slide just as a bit of a reminder really of the definition, or the World Health Organisation's definition of nursing and midwifery, just really so we can set the scene. So I'm just going to give you a minute just to read that definition. So, in short, that means that we've really transformed from this. Any guesses to who it is? Absolutely, it's Florence. So we've transformed from Florence into superheroes in disguise. And then we've really transformed into this. We absolutely can't do without them. And whilst we're not Florence Nightingales anymore, we do still practice some of her actions. Nurses deliver round-the-clock care. They advocate for their patients. They're kind and compassionate and have excellent bedside manner. They utilise the patient's records and know that documentation is key. Nurses are also great change agents. They want change, they embrace change, and they enact change. So, as Ken Griffin mentioned at the end of the session just before lunch, primary health care nurses are really anything that's outside of the acute hospital setting. So they're in a whole range of settings. And, 96,000 nurses are working across these settings. Around about 13,800 odd are working within general practice. So the Australian Primary Healthcare Nurses Association is the peak professional body for primary healthcare nurses, and really has been able to provide an exceptionally comprehensive picture of primary healthcare nurses across Australia for about 15 years now through national surveys. And they really champion for primary healthcare nurses and advance their professional recognition, which I think is so important, and really optimise the role that the nurse plays in patient-centred care. So the latest national survey that APNA conducted really identified that immunisation activities were the most common, or amongst the most common activities a primary healthcare nurse performs each day. And while that survey really captured activities such as cold chain management and administering adult vaccinations and using recall and reminder systems, nurses do so much more. Anecdotally, we understand that it is, on most occasions, the nurse in general practice that's tasked to actually administer vaccines to children as well as adults. They manage vaccine stock to reduce vaccine wastage. They calm nervous and anxious children and adults. They check the air records. They explain the risks and benefits. They perform pre-vaccination checklists. They obtain valid consent. They administer the vaccines and record them on the air. And they add in the next recall and reminder. So how many vaccines are actually administered by primary healthcare nurses? Excellent question. And that's due to poor, or should I say absolutely absent data that is not captured. So we don't have a full understanding of how many vaccines are actually administered each year by nurses in general practice. There's a little bit of a play on the abbreviation of GP, because when we talk about GPs, we're often talking about the general practitioner. But then we often talk about GPs as in general practices. So nurses in general practice are often the vaccinator, not the actual GP, although some of you actually do vaccinate. But what we do know is stated in the 2021 AMA position on vaccines outside of general practice is that general practice does see around about 82% of children less than 15 years of age, with immunisation consistently the second most prevalent reason for attendance. And this is really reflected greatly in the childhood immunisation coverage data, which really tells us that we have got very good coverage rates, and Lisa showed those graphs before. So along with the Australian Immunisation Register influenza data that was revealed last year, and this is the data that was captured, March to October, general practices administered 5,765,323, very important 3, doses of influenza vaccine. So if nurses are administering the majority of these vaccines in general practice, they have been very, very busy. Brenton's going to be talking from the pharmacist's perspective. But what we can say that nurses have been exceptionally busy and have been and continue to be a key component in all vaccine programs. But collaboration between GPs, as in general practitioners, and practice nurses is absolutely vital in ensuring that patients are getting vaccinated promptly with the recommendations. We all have a role to play. However, nurses do have many, many touch points with patients, and they can use these touch points to promote vaccination, discuss the risks and benefits, alleviate fears in vaccine hesitant patients, and certainly provide opportunities for opportunistic vaccination. Nurses are very good at observing the immunisation halo: health, age, lifestyle, occupation of the patient. And this will ensure, of course, that vaccination recommendations are discussed. They'll also assist the patient to make a follow-up appointment for vaccination if they can't be vaccinated that particular day. Nurses will use every opportunity they have to plant a seed. And this is done during those many touch points. And while it might not result in vaccination on that day, the patient is sent home with something to think about. And certainly we all have heard previously, and we know for sure that there is strong evidence that supports a recommendation from a healthcare professional that really determines vaccine acceptance. So we're very aware that there is a GP shortage, as in a general practitioner shortage. So we must use their time wisely. So where legislation allows, registered nurses can administer vaccines under a standing medication order. This allows for nurse-led vaccination clinics, which are especially useful during flu season or disease outbreaks. These clinics are very convenient for patients because they don't have to wait specifically to get in to see a GP, and it frees up the time for the GPs to see the sick people that they need to see. The downside, of course, of that initiative is the current GP-led care funding model that we are working under. The practice can only bill Medicare if the GP sees the patient. Hopefully, this will change as we lean into the Australian government's primary health care reform and embrace multidisciplinary care and models. We're seeing more nurse practitioners coming through the system. But once again, funding must change if nurse practitioners are to be better utilised and embraced in primary health care. Nurses are really keen to expand their knowledge and expand their scope and attend education sessions. And vaccination is a key role that they play in general practice, and nurses must work within their scope of practice. And not all nurses have worked within the vaccine program previously, so they're keen to learn it quickly. Establishing a champion nurse in your practice is a step in the right direction also to increasing vaccine awareness and uptake in your practice. So they are cold chain and vaccine management experts. They give advice about vaccinations, whether they be funded or not funded. They're well educated, experienced and resourceful, and have a place at the table for designing vaccination campaigns. They have provided the largest vaccination workforce during the pandemic. They are practical thinkers and will find solutions. They are trusted and respected. No one piece of this puzzle is more important than the other. We need all the pieces fitting together, collaborating, playing their role to make the patient's picture complete. So, in summary, nurses form the backbone of Australia's primary health care system. So thank you very much for listening.
We do have a couple of minutes for questions before the actual discussion. Yes, please. Oh, I don't know your name, sorry.
Thank you, Angela, for that presentation. I'd just like to endorse your conception of nurses as being the next best thing after angels. I assure you that nurses are playing a more important role in the provision of healthcare to the community. There are nurse practitioners in the drug and alcohol rehabilitation scene. There are also nurses in the priority primary care clinic scene, where they do the triage before seen by the doctors. So yes, your value is being recognized. In fact, I first recognized that as a registrar surgeon when I did my first scrub up with the head nurse, and there was a big sign in front of the scrub which said, "Nurses are here to protect your ass, not to kiss it."
Love it, absolutely.
We've already agreed that messaging is important, and that was a very clear message, possibly aimed at surgeons. Are there any other questions or comments? Yes, there's one.
Perhaps just a statement. My name's Alex Flintoff. I work at local government and we run immunisation clinics through local government. There's 79 local governments in Victoria, and we provide 40 to 50% of immunisation to the under 5-year-olds in Victoria. But our funding is totally inadequate. We are also encouraged to do adult immunisation by the state and federal governments, but no funding at all is supplied for those vaccines or for the administration. And therefore, many local governments say we're not doing it. So I think we are a really big provider that is inadequately funded and would really make an impact on all levels of immunisation, both adult and our under 5s, if we had funding, but it's not provided.
And I'll agree 1000% with that. And I think that, all of the governments are wanting increased vaccine uptake. We talk about, the low vaccine uptake with pneumococcal vaccines. Shingrix hasn't even been dispensed, of course, to, the primary healthcare sector outside of general practice at this stage due to the issues that have already been highlighted around it. But absolutely no funding, not 1 cent is given to local government to administer an adult vaccine, and certainly funding models must change if we want higher vaccine uptake, for sure.
Thank you. There's one last question or comment from Rod.
Yeah, I guess having been playing this game for 25, 30 years, that Australia had a 55% childhood immunisation rate, as I keep talking about. So funding was added to general practice, but funding needs to be added to any providers. And so the risk is that when we talk about funding a particular group, we've got to remember that it's actually the investment in preventative health medicine that Australia misses. We've got very little look at the fence at the top of the hill. We're flashing lights and running a hospital system that's getting worse and worse and bigger ramping. It's the prevention and the investment. So it's not just in nurses, it's not just in pharmacists, it's not just in local government, it's actually the whole team, as you mentioned. And Australia needs a bigger investment, otherwise we just fall off the cliff and flash the lights and do worse.
And we'll never stop ambulance ramping if we don't improve primary health care. That's the bottom line.
Thank you.
Thank you.